And we're back today at the lovely clinic of Fresh Laser and Aesthetics in Macclesfield, Cheshire, talking with Joe. And we have a interesting day because we're going to be doing some filler, which I have talked about a few times. I've said, yeah, we're going to get on to filler, but we are finally doing it. And it's thankfully we have Julia, who's agreed to let us film her having her filler treatments. And it's not your first time, is it?
Nope, it's not, no.
You have had a few.
Just being plucked out again today, yes.
Yeah, so we'll get to see the whole process, and also I'm going to have a few questions for both Julia and Joe. I'm going to remember which one's a Joe and which one's Julia. I'm going to stumble over that, I think, today. I think my tongue will get wrapped up in it, but you know, we'll carry on. I'll have a few questions about, tell me a little bit about filler, because I've always been terrified of the horror stories. You know, there was that actress that ended up with the big lips and they called her duck face.
Leslie Ash.
Leslie Ash, poor thing.
Yeah.
So, is that the same stuff? What are we dealing with today?
So Leslie Ash, there was a permanent fillers which are now not really available on the market. This is this product that Julia's having today is going to break down over around about a 9 to 12 month period. How long did you last?
A year.
It'll last for about a year.
Exactly, a year, yeah.
So it basically is a substance that just naturally breaks down in the body.
So it's not permanent like Leslie Ash's?
No, not at all. It's not a toxin, so it's not a prescribed substance. It's not a medicine like Botox, like botulinum, that we talked about before. So we don't need to have it on prescription. However, you do need to be medically qualified to administer the product.
Okay. So what is it actually, what's the science? What is the filler?
What's in it?
Yes.
What's in the
like before we discuss what's in Botox, but what is in filler?
Okay. So filler is made up of a product called hyaluronic acid. And that is like a collagen type substance, and when it's injected into the skin, it attracts some products are called hydrophilic, so they will attract water to them, and they will plump the skin from underneath. So it's a synthetic collagen mimicking ingredient. But as I say, it's not a toxin and it's not a medicine, so it's not a prescribed substance.
And is it very similar to what you have naturally occurring in the skin?
That's right, yeah.
What's going on underneath, and it's just kind of, you're putting something back in that's going to behave
absolutely
as what you were making naturally before when you used.
And there's different strengths as well. So for example, if we've got just some very fine lines, maybe around the crow's feet area, we'll use sort of very, very light products. For deeper lines, which we're going to work on Julia today, we're going to work on these lines here. These we call the nasolabial folds. We're going to use a product called Deep Lines, which is a bit firmer and it's going to last a bit longer.
So it's a bit thicker.
Yeah, a bit thicker.
And it pushes the skin up more.
Absolutely,
So
literally.
Does it expand more?
Fills the skin.
Fills it in.
Fills the line. Yeah.
And the thinner stuff, is that more gentle, more just to get some...
And that's really great just for doing the very first lines. There's also fillers, dermal fillers, which can create volume. So we can put volume into the cheek area. You know, you can inject a bolus and you can create a lift on the cheeks. It is, you know, there's a lot you can do these days.
So there's different types of fillers.
Yeah.
So today are you using one or two types?
So today we're going to use one type, which is a product called Teosyl Deep Lines. It contains lidocaine, which is local anaesthetic. So we've already prepped Julia's skin, we've removed the makeup and we've cleaned the skin, and we've put some local anaesthetic cream topically onto the skin.
Okay.
So she's going to really not be in too much discomfort at all, but the product that we're actually going to inject under the skin also contains local anaesthetic, so it's going to be very comfortable procedure for it.
When you put that stuff in, because it's got the local anaesthetic in, it doesn't hurt so much.
Not
Is that the whole point of it having the lidocaine in the product itself?
It's really comfortable.
That's good, so they don't have any after pain.
It might feel a bit tender afterwards.
Do you need much downtime?
You can, generally when you have these nasolabial folds filled, there's not a lot of swelling and there's not a lot of downtime, unless somebody's particularly prone to bruising, if they're on certain medication or something like that. But generally speaking, these areas don't bruise too badly. If we're to inject the lip area or the border of the lip or around the eyes, that's a more vascular area. you're more likely to get some bruising, but generally speaking, there shouldn't be too much bruising or swelling for Julia today.
Great, thanks. Julia,
Yes.
the questions that I have are, what happened when you first had filler done? Because you said that you've had it a few times. So tell me, why did you have it done, and what was your experience in your relationship with the change to your face?
Well, I wanted really to take a few years off how I looked, because I realised I had these lines on my face, and having the fillers is instant. As soon as you've had them done, you lose the creases in your face. So I really, really enjoy it.
It's not like Botox where you wait.
No,
could be
and
12
it
days.
lasts longer for me. So I have it done each year, and Joe does it for me, and I just absolutely love having the treatment because I just feel instantly better. I've got a big wedding that I'm going to in June, and I want to know that when I go to the wedding, no matter how nice my dress is, I want to make sure that my face looks good and I don't have lines on it.
So you actually see it instantly.
Instantly.
So we're going to have that experience today.
We
then. When we
are.
watch you
We
have
are.
your
I
filler
hope so.
done, we'll get to see the
I hope so,
instant effect.
And I just enjoy, for me, not looking my age. I enjoy to look younger. Some women aren't bothered about it, but I am, and it depends on what you want as a person.
I mean, do you mind saying how old you are, Cameron?
I'm 61 in April, so yes, I know. So I've been having these treatments now for about 8 years, and I really...
Because you're
I've kept
still
on
like a
top of-
40-year-old woman.
Thank you very much indeed. Yeah, well, it's only because I have these injections, and I also have Botox, and I enjoy to have them because I feel that it doesn't make me show my age.
And Jo, she tells you what if you need a bit
heavier, yes,
filler or lighter filler, and she decides what.
That's right. Jo says yes, and today I think we're doing these here today, and I'm also having these done here, and so it can have your lips done, everything. So I enjoy having it done.
Jo's going to start doing the injections now.
Okay, so we're going to start off on this side. We've prepped the area, we've got an aesthetic cream on, we've just sterilised the skin, we've cleaned the area. I've just done a couple of little injections up here already, and I'm now just going to go into this corner here. Okay, where we can get quite a lot of loss of volume here, and it's one of the first areas of the face.
That needle goes in quite deeply.
Yeah. What I'm doing just here is a fanning technique.
Right.
So we don't have to make loads of entry points, we just make one entry point with a needle.
So you're coming in and out with a needle?
Just coming in and
same
out.
area,
It's just this little
same
triangle
entry.
area here. Yeah, I'm just going to put a little bit more volume just into here, this bottom part. This can just feel alright there, Julia.
Mm.
Can just be a little bit tender here.
I can see why you had a
See,
bit of
just
anesthetic
lifting
cream
the
on
skin.
it.
Yeah.
Doesn't hurt.
You're fine with it, aren't you?
Yeah. So I'd rather have it than not have it.
Yeah. So you went in with one entry point, like you said, a little fan movement.
Make a little fan just in and out. It's like a little goose's foot. So one line of thread, in again, and it just creates just that area of volume just in this corner of the nose where we really can start to just lose that volume. So we're just going to follow the line down now.
It's interesting to watch the technique. It's quite clever, actually.
And you just need to keep stepping back and having a look at the face, making things, sure that things look nice and
It's a
symmetrical.
bit of an art form,
It
aren't
is
you?
a little bit, yeah. So I'm just going to have a step back in a minute. I'm just going to look at both sides, and I think we're probably going to put a little bit more product.
I wouldn't want anyone unqualified doing that.
You wouldn't, would you?
No. That's scary.
Not in your face. When you got
No,
one
because when you
face.
see, when you realise that there's quite a bit of skill going in with how she's positioning the needle, how much that she's putting into it at a time.
And the product does feel quite nice and soft in the skin, but we will give it a nice massage in a little bit and make sure
Really.
that it's, just give it a good rub around, really. Okay, and then just going to have a tiny bit of product in here, Julia. Did you put cream down here?
I don't know.
That's one syringe.
Right.
But it takes a lot for my face.
Okay, so we're just going to go into this now. On Julia, on this side, she is not as deep lined on this side of her face, so we all have some asymmetry on our face, and Julia probably sleeps more on this side than she does on this side, am I right? So
that loses volume more.
yeah, it gets more creased. So as a result, we're probably not going to need quite as much product on this side as we did on the other side. And it's important, obviously, to keep a natural look, to keep some of that asymmetry, and just to soften up and keep it looking really fresh and natural, because no face is completely symmetrical.
But also you don't want to go and put too much product in, and that face looks, that side looks far more poofier than the other side.
Yeah.
Because that's the side that doesn't need very much.
Yeah, that's right. We hardly need any on this side compared to that side. You must do a lot of sleeping on the other side. Or Jim does a lot of snoring. And you have to lie on that side to turn away from him.
Definitely.
That's what it is.
Absolutely.
To blame Jim. So I'm just going to do a little bit of pressure on here, and because we've not really needed to use much product at all up here, I'm going to concentrate the rest on these lines down here, or these, not so much lines with Julia.
It's a dipping.
Just a slight loss of volume, and then again I'll go back to the other side and pop some more product in on there as well. So I have a nice bit of pressure on there.
You'd be so brave, amazing.
Honestly, it really, really doesn't hurt. It's fine. Because it does have anaesthetic in it, the product, doesn't it?
Right.
Yeah.
Well,
Really
which you
doesn't
mentioned
hurt,
before,
yeah.
so it doesn't go in and sting, does
No,
it?
not at all, no.
Yeah, there are some products out there that are more uncomfortable than others. But these days there's generally no need for somebody to be experiencing much discomfort at all. When
Because most of them have an anaesthetic in them.
The majority of them do these days. Yeah. We used to do dental blocks around this area when we were doing filler, but again with the products now, there's just no need really to put a patient through that. A lot of people don't like dental blocks.
It's more a nuisance when you have dental
It's
blocks.
isn't it? It's more time consuming,
Yeah.
it's uncomfortable, you've got your whole downtime, you've got to wait a couple of hours for it to wear off,
Gosh,
you can't drink, so an
anaesthetic cream and then a good product like this filler that has an anaesthetic within the product itself is a lot easier.
much better, yeah. So I think we'll come back now and we'll just pop, we'll come back to this side.
Right.
And concentrate a bit more on this side. Okay. So what we're going to do now with the, some product that we've got left is we're just going to give Julia what we call a happy mouth. So as you can see, the corners of the mouth, as we age, gravity starts to pull them down and they start to turn down a little bit.
Yeah.
And what we're going to do is
I'm even getting it.
we all get it, and we're just going to pop a nice little bleb of product around this corner, and it's just going to do that basically. And it's just going to lift and just fill this little loss of volume here and just really plump things up. And then we might just finish with a little bit of Botox in the chin, just 7.5 units on each mentalis muscle. And what that will also do is pull the chin down, pull these mentalis muscles down, and just turn up the corners of the mouth in turn. It acts like a little trapeze.
It's like a little
that.
facelift.
Yeah, like a little mini.
Wow, without the surgery.
Lift, yeah, liquid facelift we like to call it. So if you want to just relax for me, Julia, and then we're just going to pop in here. Okay.
So I wonder how much people can avoid surgery nowadays
I think.
with really clever
Yeah.
procedures like these.
I think if you start early enough and you're realistic within your expectations, then you can. You're just going to blab out there. You can avoid it, but if you just look at them, we've just turned up that corner now.
There was a supermodel that I read an article about the other day. She was talking about this, Christy Brinkley.
Okay.
And she said that because of all the clever procedures out there with your fillers and your Botox, that you don't need necessarily to run to a surgeon and have go under the knife.
Yeah.
That there's some very clever stuff that you can do that really gives you that lift that you need. And I can see now from watching this what she was saying.
I think it's just a case of just keeping on top of things.
Yeah.
Just open up your mouth for me, Julia.
Like you said, you can give it a bit of a lift
Yeah.
and
Just going to give that that a little massage now. If you just open up for me, that's fantastic. And so Julie's just going to be quite aware of this feeling on the side of her cheek. You need to be careful not to bite your cheek. Bite the inside of your mouth.
Oh, this is
It's just going to be a little bit swollen, and it just feels like a soft pebble on the inside of her cheek. But in a couple of days, this will just settle, and she'll just forget it's there, and she'll just have a lovely, happy mouth. Okay, so on this side, we haven't got as much loss of volume. Because we talked about the fact that Julia sleeps on the other side, so we really hardly need to pop in any at all down here. It's just a couple of little blabs just to support these corners of the mouth.
It's really clever.
And just to give her that little lift that she needs. As I say, Julia has looked after herself, so if you just open your mouth again for me. And then we just give that again a little massage, but again there's not as much on this side as the other side. Okay, so we're just finishing off now, just with a tiny bit of product that's left.
Yeah.
And we're just going to go into this area here, finish off the happy mouth.
Super.
Okay. Tiny bit more. Okay, that's just done.
Jo's going to come back in and she's going to put some Botox in the chin. And I think that's going to have some sort of lifting effect, isn't it?
It is indeed.
Wow, and
So
just-
yes,
It's going to get rid of all the little creases,
that's
teeny little
right.
creases
Creases on my
here.
chin, yes.
So
Very
fantastic.
aging.
We're gonna, yes.
Very
Well,
aging.
that's the thing. It's the little creases that we don't like, and we get some fillers and Botox, and it
That's
just
right.
smooths it all out.
Fabulous.
Makes us feel fresh again.
Yeah.
Little Botox in the lower part of the face. We've talked about Botox before and how generally it's for the upper part of the face, but it's a really nice way of just finishing off a dermal filler treatment. When somebody's had work around these marionette lines down here, what this will do, we put the Botox into the mentalis muscles here, so there's two, so we've got one here and we're here, and what that will do is it will pull this down. So,
and that's better than using a filler to get rid of those lines.
we can put a filler in here as well, which is also a really lovely thing to do. I mean, the more we do, the better. But what this will do, having the Botox in the chin, is a double whammy of it will relax this jaw area and it will turn up the corners of the mouth.
Oh, so it's a dual effect. That's why you're using the
add
Botox.
in, yeah, so great for this crease here and for adding into the happy mouth a little bit more as well. Not only that, if people grind their teeth, again, it just relaxes that lower part of the jaw.
I've heard about that.
So we'll stop some tooth grinding as well, because again, tooth grinding becomes,
I'm a tooth grinder.
I am as well, and it becomes very aging onto the neck as well, because because of the action that if you wake up and you've had your jaw
Grind all night.
set in that position all
Yeah.
night, you're gonna get Deirdre neck, and nobody wants one of those.
Oh, okay.
So
Super. So you can get the needle in?
Yeah.
Yeah.
I'm gonna pop it in here. So Julia, if you can just push your jaw forward for me, just kind of. That's brilliant. Just stretch your jaw out. That's great, and then relax. Okay, that's fantastic. Okay, so we're just going to pop a little bit in there. That's one. Okay, and then same on the other side. And again, it's just a really nice way of just enhancing what we've done. And as you know, this isn't going to really take effect for about 3 or 4 days, but then Julia's just going to gradually just feel, she's going to have like a slightly, very subtle heavy feeling in her chin, and it's just going to relax everything, give her a nice full bottom lip, turn these corners up a little bit more, and just relax that crease out a bit more as well.
It's quite clever.
Yeah.
Super.
But I also find as well, when I have my fillers, it plumps your lips out.
That's it.
Definitely, without a doubt, yes. Yeah,
Brings everything up.
yeah,
doesn't
that's
it?
right, yeah.
Because you have fabulous lips naturally.
Yeah,
Yeah,
no, but you know,
but
to
it
have them
brings-
filled as well.
Stretches all this as well,
It
doesn't it?
fills them, yes. It's
And then what we'll
fabulous.
also probably finish off with in a week or so is a really nice 20% glycolic peel. Once the skin's all settled, and that will just plump up again any filler that we've put in. It will give everything a boost. Also boost the lip line really nicely, and then probably a red carpet facial, super facial over the top. We'll go over the eyes, we'll go right under the
I
eyes.
can't wait to see one of those.
Freshen everything right up and give the whole skin a boost. Because anti-aging, obviously, it's not just about filling a line or removing a wrinkle. It's about fresh skin all over the face, all over the neck, the hands. It's the whole package.
Yeah.
So we're just massaging the skin now. Where the product is in. Does it feel nice and smooth,
It feels
Julia?
lovely.
Yeah.
Really nice and fresh.
Good. So all I'm really doing is just giving the skin a gentle massage where we've got those, where the specific areas where we've injected. I'm just giving it a little bit of a...
Does that help with the filler settle?
Yeah, just encouraging it to settle in. And filler is, Julia's right in saying it is instant. And we do see the benefits instantly, but also as the skin, as the filler settles into the skin, the product settles, over the next week or so, it's going to plump out more and it's going to look better.
Right.
So it's just going to look better and better, really.
So we've not seen the full effect
We
right
haven't. We'll see Julia when she comes back for a superfacial in a week's time. She's going to look even more, she's going to look $1 million. And this... What we're just massaging into this area here as well is just an arnica cream as well. It's just got some cooling properties in it and some soothing properties, so it should just hopefully settle down any redness and just stop any bruising from coming out. She's going to have a tiny little bruise here on the corner of her mouth, and again the mouth is a vascular area to inject, so you can often get some bruises. So if Julia will take one of these creams home and she'll just keep massaging with that. And it should all start to settle really nicely.
Great. It's even starting to look very
Yeah, looks good.
relaxed now.
Yeah.
It's all calmed down.
It feels okay, doesn't it?
Absolutely fine.
Good.
Yeah, absolutely fine.
Good.
Yeah.
Great.
But I always say to people to give me a call if they're worried. You can put a bit of ice on there tonight. But this is what we're talking about, it getting better as the days go on, because actually, as this swelling goes down, this line is going to look less obvious.
Right.
We've just got a little bit of swelling here at the moment, so again, that's just going to improve.
Super.
At least there's no lines there.
No lines.
No lines, they're all gone. I have more lines than you now. Well, thanks a lot. That's been so good. And Julia, thank you for letting us film.
you.
That's been really brave of you. Some women pretend that they've never had anything done. They'll
Oh,
lie,
no.
they'll take it to the graves. So it's amazing that you let us film
Thank
this
you.
and you've talked so openly.
Thank
and
you.
thank you again, Jo.
Thank you,
Fantastic
Sam.
work
Thank
as
you.
usual.
Thank you.
Yes.
Thank you.